There are modifiable risk factors, there are non-modifiable risk factors. And amongst the major non-modifiable risk factors are, unfortunately, getting old. We really can't do anything about it. Everybody's going to get old, and when we know that as people get older, cardiovascular disease affects them significantly. There's a very high incidence and prevalence of heart disease in people as they age. The first increase in incidence of heart attacks occurs at the age of 40 and above. Following that, the next increase that you see significantly is in individuals who are over 60 years of age. And by the time people reach the age of 80 and above, nearly 75 to 85% of people have some form of cardiovascular disease. So it's unfortunately a disease of aging population. And as you know, that our population is aging, and we will be facing more and more cardiovascular disease. Unfortunately, we cannot modify that. Along the same lines, we also cannot modify the fact what we've inherited from our parents. And family history of heart disease is a very strong predictor of cardiovascular events. So if first-degree relatives have cardiovascular disease before the age of 55 in men and 65 in women, they're at very high risk of having heart disease going forward. And unfortunately, men tend to have more heart disease than women do. They tend to have heart attacks sooner, but after 60 years of age or so, men and women catch up in the incidence and prevalence of heart attacks. Women are usually protected by the hormones, but that protection goes away after the menopause. But there are still risk factors that we can do a lot about. The traditional risk factors that you know of heart disease are high blood pressure, high cholesterol, physical inactivity, diabetes, smoking, and stress and depression. We have to act on all different types of risk factors.